lots of various funding institutions that have helped with this. Our diagnostic laboratories at the various colleges do a fantastic job, and I'd like to recognize some of the practices that we've had a chance to work with in Minnesota. Iowa State University, some great work being done over there with Jeff, John, and Daryl, and we'll hear some more about that work. Our Minnesota group has been active, as you know, and I think BI has done a great job with stepping forward and providing some leadership and support here as well. So it's a team, and everybody's important, and everyone has a very important role to play, and we won't be able to succeed unless we all play together. So really, I'm quite optimistic, and I sense a lot of optimism in the audience today, but also in the industry today, as I visit with people that are interested in PRRS eradication. Bob mentioned the ASV position statement that came out a few years ago. We understand that we'd like to get this virus out of our systems. It's simply too expensive to live with, and it is the long-term goal. But since that time, I think what's really exciting, in the last couple of years, there's been significant progress in a number of areas. Questions have been answered that have plagued us in the past. New tools have been developed. And people are really getting organized, and we're hearing about that already, and we're going to hear more about it today. So I think there's been some development of some very interesting tools that I just briefly want to highlight again, and I think everyone's familiar with these on an individual basis, but when you look at how you could collectively utilize them in the toolbox, so to speak, it gets pretty exciting. And a lot of these tools I just want to briefly run through are oral fluid sampling, air filtration, therapeutic vaccination, risk assessment tools, GIS, and then provide one other example of an organized group. So a lot of progress. First, I think this is review again, but this is just some outstanding work that's been done at Iowa State University with Jeff Zimmerman and John Prickett. It's been published, and this is the use of oral fluids for detection of PRRS virus and other pathogens. And I think it's a really great opportunity for us to have a tool to survey and understand with a very cost-effective approach and a very simple approach to understand the PRRS status of large populations. I remember talking with Jeff Zimmerman a few years ago, and Jeff said, I remember that he made this comment, it's got to be so simple you can put it on a note card. You know, and I think, and you're familiar with this, a lot of you are using this already. You know how well it works, and you know how easy it is to do, and you know how cost effective it appears to be. And so, I mean, it's got a swine application now with a rope, very easy to collect, and a lot of work being done on multiple pathogens besides PRRS virus. But that was the leading one they worked with, and not only antigen testing, but antibody testing is underway. So a lot of credit to the Iowa State group for getting that going. Air filtration is something we've been working on, and I think this is something that's exciting as well. It's for the first time we've been able to prevent the spread of virus between farms. We're going to talk more about it tomorrow at the International PRRS Symposium. But we know that airborne spread of PRRS virus and other pathogens is quite extensive. We've documented out to 4.7 kilometers and recently up to 9.1 kilometers from an infected source. We'll talk about that tomorrow. We've been able to use models to test whether the filtration technologies are effective and also to develop new strategies to reduce cost. And now we're getting out of the experimental phase and into the field, and it's been fun to work with Gordon Spronk, Darwin Reichs, and Paul Ruin from the Fairmont, Pipestone, and Swine Vet Center clinics and see how this strategy can be applied and sustained in the field. And that's in process, and that's CAP 2 funded. Therapeutic vaccination, still some questions here on how to apply this in the field, but I think some very interesting work that John Polcano did with his PhD program at Minnesota. He presented this information at last year's BI meeting and showed that using modified live vaccines in more of a therapeutic approach, repeated application of a modified live vaccine to an infected population. So rather than a preventative, come in as almost as a therapeutic intervention. And what John Paul's study showed us, that there were some strengths to this approach. Most exciting to me was the ability of this approach to prevent shedding of field virus or wild-type virus to commingled sentinels. That was exciting, I think, of work in the pen that showed that perhaps this application could be used to prevent shedding within large populations and maybe reduce shedding of virus outside of the facility into the environment. We don't know that yet. That needs to be tested, but these are some, I think, some interesting preliminary data. Of course, it reduces clinical signs, and there were some limitations too. We learned that the MLV vaccine did not prevent infection. It did not produce sterilizing immunity. So obviously it's not the silver bullet, but perhaps it is a tool we can use in combination with these other tools. The PADRAP, I think everyone's familiar with the PADRAP, the Production Animal Disease Risk Assessment Program that Dale Polson developed and now Daryl Holtkamp is working with. Everyone, I think it's important to remember that this was a gift to the ASV from BI in 2006. It's got a breeding herd focus with a grow-finish development phase, and there's been quite a bit of training going on of veterinarians through the ASV, and the other day I asked Daryl how many actually site assessments and veterinarians have enrolled and been trained. 1,707 risk assessments have been completed so far. 992 sites are enrolled in their database, and 226 vets have been trained. Obviously, the applications are to evaluate biosecurity protocol efficacy over time and to aid in the decision-making regarding herd and regional elimination plans. But I think this is a marvelous tool, and we've already heard it talked about a few times, but it's something we need to use to better understand our regions before we begin. That segues nicely into some of the work that Peter Davies, Spencer Wayne, and Enrique Mondaca have done using GIS software to basically assess, monitor, and manage the PRRS status within an area and region. We've already seen many slides with maps, and that's becoming kind of a standard operating protocol now, is to get a map of the area to better understand it. A lot of the practitioners in the state of Minnesota, I know, are utilizing this technology. It's actually gone to a web-based system, makes more real-time. Peter's done a nice job of developing that. Obviously, applications to organize an area of farms to facilitate communication and decision-making, and to analyze animal flow patterns entering and exiting an area and region. So if the old phrase, a picture is worth 1,000 words, is clearly applicable to this. And it's good to see everybody jumping on board and getting their areas mapped. The last example is really just one example of how a group is organizing itself to go forward with some decisions at the state level. I'd like to introduce this to you. I'm not sure if many of you are aware, in Minnesota we have what we call the Minnesota PRRS Eradication Task Force that we organized in 2006 based on the Ontario model. I had the opportunity to spend some time in Ontario, and I learned about their Ontario Swine Health Advisory Board. And they had a very nice organized group of producers, industry, practitioners, academicians, and I wanted to do something similar to that in Minnesota. The plan, obviously the mission, was to develop and oversee the plan for PRRS virus elimination in Minnesota, and we wanted this group to be ready and proactive at the time when the time is right. Just a quick overview of the participants in this group. We've got regional producers and practitioners. We've got a number of people involved from our swine group in Minnesota. The Minnesota Veterinary Diagnostic Lab has representation. There's representation from the Minnesota Pork Producers Association, Minnesota Pork Board, and the Research Committee of the Minnesota Pork Board. The Board of Animal Health is becoming more involved in this group, as well as the National Pork Board. And so we tried to put together a very collaborative, well-represented group that gives us a nice overview of people in our state involved in the swine industry. One of the things we did right away, and I think it's important, is to put together a roadmap to success. And I just want to go over this quickly. This is just an idea we had. Let's put something down on paper with some short-term, some medium-term, and long-term goals. And you can see we've got years 1 through 5 on short-term, medium-term 3 through 15, or 3 through 5, and long-term 12 to 20 years. Now, hopefully this won't take 20 years, but that was done a bit politically at the time when people weren't so sure if this is something we should go forward with. It just kind of helped settle everybody down. said this isn't something that's going to happen overnight. This might take a very long time. So let's relax and let's not worry about somebody telling you what you're going to have to do. And so hopefully this will take less time, but this I think was a good calming influence as a way to kind of approach this, especially when talking with producers. So we laid out our goals and wanted to cover a number of key areas that we thought were important to elimination of this virus from our state. Obviously, we had a very intensive research focus, and you can see we've kind of set up some research projects that we felt we could accomplish in the short term, such as getting maps made, biosecurity assessments, some of the things we've been working on. Mike Murtaugh has been developing some differential diagnostics, going into some demonstration projects like we heard about Stevens and Rice. And then as we get to some of these more difficult topics, which are going to take a little longer and a little bit more effort and time, but they're very important and we need to put them on our radar screen and understand what we know about each of these areas. Obviously, herd monitoring throughout the state is going to be important. That's going to be a constant throughout over time. And again, the oral fluids work, I think, is the key to that. Application. Once we get this information, can we start regional projects? And of course, Stevens and Rice were the early ones there. And hopefully, if they were successful, and it looks like they're moving towards an expanded phase now, and then maybe we get to the point down the road where we have positive and negative regions, and therefore the idea of the Highway 212 border that you saw with Bob's. Communication is important. We started talking about this. Obviously, we organized the group. We put materials together. We distributed those materials. We made presentations to raise the awareness throughout the state. We've built teams with practitioners, and we're always in a constant communication phase. And hopefully, if things go well, we'll start small with success and get bigger over time. So this is just one example. It's probably not a perfect example. Maybe you have better ideas on how you can do it in your state. This is just one idea that we came up with in Minnesota. So to conclude, I think it's really exciting what we're up to and what everyone's coming together. We're tired of PRRS. You know, to look at some of the comments Tim Lola makes, you know, the industry is tired of PRRS. We have to move forward. I think a lot of questions have been answered. We now know that airborne spread of PRRS virus is a significant risk factor. We now know that regional PRRS programs are possible and are successful. We're seeing it happen in so many places around the country now. It's just really, to me, very, very exciting. And again, the toolbox is getting bigger and more exciting, more extensive, more validated. Oral fluids, air filters, and some of the mapping and risk assessment tools, I think, are just... We have so much more now than we did a couple of years ago. To me, every day is an exciting day when we're talking about PRRS area control programs, because I think we actually know where we need to go, and we've got the information and the tools we need to get it done.